I think that each family needs to sort out how they're going to care for each other, especially once somebody has a diagnosis of cancer or a serious illness. And that what's really important is that people express their expectations, both with regard to the person who has cancer, the man who has prostate cancer, as well as the people around them who want to provide care. Because we often have unexpressed expectations and we make assumptions about each other and what others might expect of us. And so it's really important for families to learn or to develop skills in having honest conversations about, this is what I want, this is what I don't feel comfortable with, this is what I would prefer somebody outside the family to do for me, this is what I feel comfortable you doing for me. And so that people can let others know how independent they are, how independent they want to be, and that people are also very clear in expressing how they would want to provide care. I would like to bathe you, I don't want to bathe you. And so it's that simple. And often, until somebody has an illness, we don't even talk about those things in our families. So we don't know what those expectations are. And I think that unexpressed expectations add stress. Sometimes they can lead to misunderstanding and awkwardness in relationships, and sometimes they can result in anger, and which comes out of frustration. So it's really important for people to be able to express those expectations. And the other thing is also for people to be honest about their feelings. Right, that they can express their feelings in a respectful way, but often we also have feelings about feelings, so that we think we shouldn't. I shouldn't be sad. I shouldn't be frustrated. I should love you unconditionally and just keep providing care for you. The care provider might be getting tired, might wonder when this is going to end, when will they get their life back. All of those are very normal outcomes of being in the service of somebody for a long period of time, or through a period of time when somebody is very, very sick or different from what they used to be. So it's really important that people talk and learn how to have difficult conversations, awkward conversations, and to express things that they may not have been able to talk about prior to the illness. I guess that the opposite side of that, don't make assumptions. Don't make assumptions about others. Don't assume that somebody wants your help. Don't assume that they don't want your help. Don't assume that just because they're quiet and withdrawn that they're angry. Make sure that you ask a question and say, something has changed. You're behaving differently today than you did yesterday. You seem so quiet. Is there something frustrating you? Is there something that could be changed? Or is it just a day where you want to just draw into yourself a bit? So I would, don't make assumptions would be, if I had any sort of don't do tips, that would be right up there.